Are you wondering if you have sciatica? Do you have a pain in your low back or your butt and everybody's told you that it's sciatica and you're wondering if that's really what's going on with you? Or have you heard about something called Piriformis syndrome and you're wondering if that's what you're suffering from and what the best treatment is? Well, today we're going to talk about sciatica and how it's different from Piriformis syndrome. So, what is sciatica? Well, it's when the sciatic nerve is irritated. The sciatic nerve starts in the lumbar spine, that's your low back, and it's formed by some nerve roots that come out of the side of your back. They come together in your buttocks and they form the sciatic nerve, which travels down either underneath your piriformis, through your piriformis, or on top of your piriformis. Now, it's about a third of the population that has each of those anomalies, so they're all considered kind of normal. And most people don't know if they have one or the other, and it's not really relevant. I'm just assuming that if it's underneath the piriformis or through the piriformis, that would put more pressure on the sciatic nerve. But it's just kind of an interesting, fun party fact that you can talk about with your friends. Where do you think your sciatic nerve runs? Anyway, all right, so with sciatica, with the sciatic nerve, it goes through the piriformis, or underneath the piriformis, or on top of the piriformis, and then it travels down the back of your leg to the side of your knee, and at that point it splits into two more branches. So that's why people who have true sciatica have pain down the back of their leg. Now, I have had some patients come in and tell me I have sciatica and it's going down the front of my leg. Well, then that's not a true sciatica because the sciatic nerve's in the back of your leg, but you do have nerves that go in the front of your leg. They just have a different name. So it can be the same cause even, but it's not called a sciatica if it's going down the front of your leg because the sciatic nerve goes down the back of your leg. So now you know. All right, so the sciatic nerve usually gets pinched most commonly at the lumbar spine. So you may have heard of these things called discs that are in your lumbar spine, and they can herniate or protrude or plump up so that it puts pressure on those nerve roots as they're joining together to form the sciatic nerve. When that happens, it usually happens suddenly, and it usually causes a sharp, intense pain down the back of your leg. Now, some people do have sciatica that comes on more gradually, but then that's usually caused more by that pressure through the piriformis. So if it's gradual, it's usually more of a piriformis syndrome, although it does affect the sciatic nerve. So, I mean, technically it is still sciatica too, but the more common cause of sciatica is pressure from that lumbar disc on those nerve roots as the sciatic nerve is starting to be formed. Like I said, most of the time it's very common to have it start very suddenly, and it usually is very sharp when it first starts. It will kind of mellow out a little bit as it calms down a little bit, but that intensity of pain will last for a few hours until it calms down enough that usually you can move a little bit. Once you can move a little bit, usually the symptoms will get a little bit better. But when it's a true sciatica, most often the pain does not get relieved until you do something about it, right? You address the root cause that takes the pressure off of the sciatic nerve. Now, one thing I wanted to make sure to talk about today, I've had many patients coming in recently telling me that they've been diagnosed by a doctor with sciatica, and it's because of arthritis in their spine. And the doctor recommends surgery. Okay, so a couple things. Arthritis in your spine is formed over time. It does not come on suddenly, right? It's an inflammation. The itis tells us it's an inflammation, and it happens over time and gradually. And it happens because there's some kind of abnormal force that's being put through the spine. So that's why with sciatica, I was talking about the disc, because usually it's the disc that puts pressure on the nerve that causes the sciatica pain. If you have a true sciatica, it usually is very sudden. Arthritis is not very sudden. It happens over time. And so saying that arthritis, which happens over time, suddenly causes pain, well, It's a little bit difficult to justify those two things because the arthritis came on gradually, but the pain came on suddenly. most commonly with a sciatica symptom. Now, do you need surgery to deal with the arthritis? This is a really common question that we get here at Physical Therapy for Everybody. So I wanted to make sure to address it today. Although physical therapy cannot change the arthritis that is currently anywhere in your body, we can stop the progression of arthritis in the long term. So that means we can keep it from getting any worse. And that's really important because we want to keep you from having to have surgery. Arthritis is formed because the spine or whatever joint it is somehow unstable. So the body is trying to lay down bone to help stabilize that joint. And it's really important to be able to support that joint with the normal ligaments, tendons, and muscles that are already in your body to decrease the stress to the joint so you don't have progression of the arthritis, so you don't have to have surgery. So can arthritis be treated without surgical measures? Yes, in the fact that we can keep it from progressing, but no in the fact that we can't actually change arthritis. And I always try to be really clear with people about that. Can't necessarily change what has already happened, but I can change what happens in the future. And I think it's important to know that information, to know that if you have been diagnosed with arthritis in your spine or anywhere in your body, surgery is not necessarily the only option that's available to you. There are definitely other options, and we would definitely like to talk to you about what those would look like in your life. All right, done with the side note. Going back to sciatica. All right, so sciatica, again, starts usually from a disc that gets herniated or starts bulging out, and then it puts pressure on the lumbar nerves, which are forming the sciatic nerve, which goes down the back of your leg and then splits at your knee. So that's where people have symptoms. It usually starts in the low back, goes down into the buttocks, travels down the back of the leg. As things progress, it'll go down into the lower leg of the foot. Occasionally, people do have pain that goes all the way down in that foot initially. That's a pretty bad one because it's really hard to put weight on that foot or be able to move. So in that case, definitely proceed with caution. I definitely recommend using some ice to get that inflammation down and take some of that pressure off that sciatic nerve so you can get up and move around, because movement is life. That's our number one core value here. And if you're not moving, you're not healing. And that doesn't matter what tissue you're talking about. That is always true. So how do I know if I have sciatica? Again, it usually starts as moderate or severe pain, and it usually comes on suddenly. So if you have a Piriformis syndrome, that's usually going to be a slower onset, but the sciatica is going to be very, very sudden in most cases. You have a loss of motion in your hips, but primarily in your back with a true sciatica. If you have a loss of motion in your hips, that tends to be more Piriformis syndrome. If you have loss of motion in your back, it tends to be more sciatica. And eventually, as things progress, the pain will turn into a pins and needles sensation. And again, it can travel all the way down that sciatic nerve pattern and even start going into your foot and lower leg. Usually the pins and needles do not start in your foot or your lower leg. Usually they will start in your low back or your hip. If it starts in your foot or your lower leg, that sounds more like a neuropathy to me. But again, you would need to have a really specific evaluation performed by a specialized physical therapist to be able to determine what the root cause of your symptoms are to get you to that correct diagnosis. Now, a little bit of a side note here. With sciatica, you can actually have loss of bowel and bladder function. This is extremely concerning because when I talk about loss, like, it is loss. You cannot hold your urine, you cannot hold your feces. You have no control. If you are at the point where you have complete loss of bowel and bladder function, I recommend you get to a doctor just as quickly as humanly possible. This is a really significant progression of sciatica and a very extreme form. We want to make sure that the nerves are preserved just as quickly as possible, and we're going to need some medical intervention to help get that taken care of. So if you are experiencing a loss of bowel and bladder function, I need you to get to a doctor just as soon as possible. It is really critically important that we affect that nerve just as quickly as possible. Now, I'm assuming if you're still here that you don't have loss of bowel and bladder function, so we will continue on. Now, with a piriformis syndrome, you're going to have more of that slow onset of symptoms. You're going to see that tightness more in the hip musculature. Usually the pain will start in the hip and travel down the leg. And you usually will have more weakness, like a true muscle weakness associated with that. Whereas with the sciatica, it's the pain that causes the weakness. So I had a patient come in one time and he had difficulty. He was huffing and puffing just walking down the hallway to get to our office. So as soon as he came in, I was like, hey, I'm gonna have you, what's your position of comfort? He said, laying on my back. I'm like, okay, let's get you on the table and lay on your back. We actually did the entire visit with him laying on his back in a reclined position because that was his position of comfort. And he was able to talk to me and tell me his story about what's been going on. Now, this one was particularly interesting because he actually had a wedding coming up. It was his one and only child, his daughter, who was getting married in 6 weeks' time. And he couldn't even walk down the hall, much less be able to walk her down the aisle. And of course, you can imagine how important this big day was to him and to her. So we decided to start immediately with kind of everything, all hands on deck, to get him able to walk her down the aisle, which he was able to do 6 weeks later. He didn't need a cane. He actually flew down to California for the wedding. He slept in a hotel. He walked her down the aisle. He made it all the way back without any sciatica symptoms at all. And when he got back, he said, now I need to be able to play golf. And so that became our next goal to work on once he had successfully walked his daughter down the aisle. And we also got him back to being able to play golf. That was a pretty big change from a man who couldn't walk down the hallway when I first met him due to his sciatic symptoms. He did have the shooting pain from his back all the way down his leg. He did have the redness and the swelling and the irritation. He had literally everything. So it was really great to 6 weeks later see a picture of him walking his daughter down the aisle. Now with a piriformis syndrome, again, it's going to be more of a slower onset most commonly. And most commonly that's due to imbalance between the hips or the ilium, that's what the bone's called, and that's causing increased stress on one piriformis as compared to the others. But if you have questions about what's going on with your pain and you're not sure, maybe the doctor's been throwing a lot of terms out at you and you don't really know what your options are, then I definitely encourage you to get in touch with us here at Physical Therapy for Everybody. We'd love to talk to you and hear more about your story and help you find the root cause of your problem. If you have any questions from this video, please drop them below. It definitely helps us to come up with new content that will serve you better. Have a great day, everyone. Bye.